Right, so let's talk about the study guide. I will try not to recite the whole thing again, okay? Anatomical components, understand that it's nerves, so pretty much work by exclusion. Which anatomical components are in the CNS? Spinal cord, brain stem, cerebrum, right? Brain. Everything that's not those three is peripheral. Does that make sense? Functional divisions of the peripheral nervous system. Somatic and visceral, right? Well, differences, know the effectors. Okay, you have sensory and motor divisions. Sensory part of the peripheral nervous system will send signals to the CNS, to the spinal cord. Motor will convey signals from the spinal cord, the brainstem. Does that make sense? Effectors of nervous system, muscles and glands. Again, we can say motor and visceral. Differences in what organs are controlled. Know the difference. Know what visceral is. Know what somatic is. Know what efferent and what is afferent. If you come to me and say, you say visceral efferent, is efferent motor or sensory? I will not tell you. You have to know this term. Am I clear? Two divisions of autonomic nervous system, sympathetic, parasympathetic. Okay. Major functions, we just talked about it. Parasympathetic is mobilization. Parasympathetic is relax, rest and digest. Sympathetic is mobilization. Does that make sense? Well, axons, know those epineurium, perineurium, endoneurium. Please know them anatomically. If you see the picture that we had in the lecture of a nerve, you have to be able to tell apart epineurium, perineurium, and endoneurium. Does that make sense? Bodies of neurons that comprise the nerve. Ganglia, if these nerves originate in the spinal cord, the nuclei. Nerve is mixed, both motor sensory. There you go. Efferent, efferent. What type of signal? Know which one is which. If you have questions, if I go too fast, let me know. And if you have questions, interrupt me. Okay, please. In what direction to and from CNS? Difference between somatic, visceral. I'm kind of reciting it. It will help you to, if you feel it all out, it will help you to learn. Cranial, spinal. There was a question. Jessica approached me yesterday with a question, what's the difference? What's the difference between cranial and spinal? Don't overthink. It's anatomical. Cranial start in the brain stem, spinal start in the spinal cord. Conscious controls. Which one of them may convey conscious controls? Some of them can, like facial can, right? Hypoglossal can. Spinal nerves can. Does that make sense? So like if I ask you, can glossopharyngeal nerve control anything? Consciously, you tell me, nope. This one can't. Optic nerve, nope. This one can't. Olfactory, nope. Does that make sense? Understand the whole process of regeneration. Okay? How Schwann cells form regeneration tube, how adhesion molecules lead the regrowth of axon, how in central nervous system oligodendrocytes cannot direct the regrowth because there are inhibitory peptides. Does that make sense? Understand that there's difference in the path of a newly formed axon versus the old one. That's why we have to, like, if we get our hand attached back, we have to relearn the skills. Kind of crosses these out. That's on you. You're going to have about a third of the exam is going to be anatomy exam will be 20 questions. 6 of them are going to be on the cranial nerves. You just have to know which one. That's it. The picture that you're going to see is that picture of the posterior aspect of the brain with the nerves sticking out of the thalamus and brainstem. Does that make sense? What? Well, it will be not the photograph of this thing, it will be actual image. Remember the one, like first image of the cranial nerves? Yellow nerves, yes. That's what you're going to see. Does that make sense? With the mnemonics and everything. Okay? Functionally. Understand what they do. You're going to get questions about it. Which nerve is responsible for chewing? Trigeminal. Okay, mandibular branch of trigeminal. Which nerve is responsible for hearing? Vestibulocochlear. Or you may get a question. You have a guy who doesn't sense any smells. Which nerve is damaged? Olfactory. Does that make sense? Okay. I'm not going to talk about everything. How can you test the functionality of olfactory nerve? You won't have to pick out one of the two answers, like, do I have to give him coffee beans or ammonia? What will be better? No. Obviously, it should be something about smell sensation. Does that make sense? Like, but you have to understand, if I ask you how would you test the functionality of optic nerve, it should be something about seeing, not about moving the eyes. Don't mix those up. Does that make sense? Don't mix up optic and oculomotor. Don't mix up glossopharyngeal and hypoglossal. Okay? Just, they're hard to mix up. Just make sure that you know distinctly what each nerve does. A few things. Difference between optic nerve and optic tract. Optic nerve from the eye to optic chiasma. Optic tract from optic chiasma to the thalamus. Okay? Oculomotor. Strabismus, lazy eye. Trigeminal neuralgia, just know that it's dysfunction of the trigeminal nerve. Same goes for Bell's palsy. Okay, it's dysfunction of the facial nerve. Function of vestibulocochlear nerve, hearing and stuff like that. And balance. Glossopharyngeal. I'm just looking for something, because all of it, if you read through it, those outlines here are similar. Just the name of the nerve that is changed. Does that make sense? Answer each question in like few statements. For this, few things. Damage to the laryngeal branch of vagus nerve. What's going to be? What is it controlled? Anyone remember? Here. No. Laryngeal branch of the vagus nerve. Huh? Swallowing is going to be gag reflex, and also voice. Yes, it controls the vocal cords. So damage may lead to the harsh voice or no voice at all. Vagectomy, like general vagectomy, will lead to I like it. Dysfunction of internal organs. Okay. Elevated heart rate. We'll get to that, since you can now synthesize the knowledge from the spinal nerves and parasympathetic system. Vagus nerve is parasympathetic, so heart rate will go up, activity of digestive system will go down. Does that make sense? Accessory, anatomically. So unique anatomically about this nerve, it starts in the spinal cord. It just enters the cranium. Epiglossal, it's all the same. Okay, how many spinal nerves? 31. Now, it's harder to memorize 31 than to memorize each set of nerves. 8 cervical, 12 thoracic, 5 lumbar, 5 sacral. That's it. Does that make sense? Good. Subgroups, we just discussed. What do they innervate? Starting from occipital region of the head and neck and all the way down to everything in the body. Okay, except for the face. Does that make sense? Rami, so we have dorsal and ventral. In this case, what we are looking for. Okay. Dorsal innervate muscles and skin in the back. Ventral innervates, usually anterior portion. Plexus, understand the physiological importance of plexus. That damage to a single spinal nerve does not necessarily mean the loss of innervation of, say, the whole arm, because they intercommunicate in the plexus. That makes sense. Dorsal goes into the back and innervates muscles and skin in the back, and ventral goes in front. Cervical plexus from C2 to C5, okay, cervical region, 4 cutaneous branches. I'd be honest with you, questions will be focused mostly on the motor functions, okay, so no phrenic, no ansa cervicalis. Ansa cervicalis will innervate deep muscles of the neck. Phrenic nerve will innervate the muscles of the diaphragm, pretty much diaphragm. Okay. Brachial plexus. The rest of cervical and T1. Okay. Functions by name. I'm not going to be too detailed on the questions about muscles innervated. Okay, so auxiliary, shoulder. Everything that deals with the scapula, shoulder blade, rotator cuff muscles. Pectoral, muscles of the chest, pectoralis muscle. Musculocutaneous, flexor of the upper arm. Median and ulnar, flexors of the lower arm and the palm. Radial, extensors of the lower arm. Does that make sense? Anatomically, know where they are. Remember those pictures that I showed you? Pictures of the plexuses. That's what you're going to see. We clear? So, I promise that's what you're going to see. So if you can tell those nerves apart, you're fine. Okay? Damage. Well, you have to understand. Radial nerve. If radial nerve is damaged, what's going to happen? What you cannot do. This. Okay? So, the hand drop, right? If musculocutaneous is damaged, what you cannot do. This. Okay? You're going to get questions like that. Lumbar plexus. Again, you see I focus mostly on the motor nerves. Femoral, thigh. What does thigh do? Muscles of the thigh, quads. What do they do? Knee. Okay. Obturator, adduct. Okay. Iliohypogastric and ilioinguinal, abdomen. Okay, a little up, ilioinguinal, a little below. Genitofemoral, sensory inputs from the genitalia and cremaster muscle. We good? Pathologist, yes. Adduct. Adductor longus, adductor brevis. Spinal nerve sciatic. So Sciatic is pretty boring. Understand that there are two parts. Okay? So tibial nerve innervates which part of the lower leg? Huh? That's fibular. Fibular innervates the shin. As you want to say, tibial innervates the calf. So if tibial is damaged, what you cannot do? Put it down. So if tibial is damaged, you have this immediately. This. If common fibular is damaged, you have this. Common fibular, it's a foot drop. Tibial damage, shuffling gait. Does that make sense? Now, things like flexion, I will be willing to tell you. So if you have a question in which you mixed up with flexion and extension, I can show it to you. Alright? Good? Gluteal, pretty obvious. Buttocks. And everything that's associated with buttocks, which is mostly the hip extension. Standing up, that's buttocks. Pudendal nerve, genitalia. Thoracic nerves, do they form plexus? They do not. What they innervate, chest, upper abdomen, and pretty much the same region in the back. Dermatomes. You're going to get questions on the dermatomes, and I can give you what sort of question. Dermatome T3 will be most likely found in cervical region, occipital region, thoracic region, lumbar region. Thoracic. Does that make sense? Now, you won't get a question. Dermatome T3 will be found in mammary, pectoral, or thoracic. Of course not. You know, you cannot distinguish. So I will be I want you to understand have good basic understanding of this. Am I clear? Same goes for anatomy. You're going to get this dude with dermatomes with arrows pointing to them. And if you're curious, I will project the anatomy questions here. You're going to get your anatomy printouts with you. If you need a color, it's going to be here. Am I clear? Understand the difference between the motor endings in the skeletal muscle, which is neuromuscular junction, and varicosity, which is a motor ending in the smooth muscle. Does that make sense? Know what effectors are? We talked about it. Neurotransmitter at the skeletal muscle is ACH. At the varicosity, it's what? What can act on the smooth muscle? Which neurotransmitters? Smooth muscle, is that autonomic or somatic? Autonomic. Which two neurotransmitters can be released from postganglionic neurons in autonomic system? Huh? Acetylcholine and norepinephrine, yes. So either of those, right? In skeletal, it's only ACH. What types of receptors? That's a good question. I like. What types of receptors do they mostly activate? Think about this. What types of receptors are you going to encounter on the skeletal muscle? Ionotropic. Why? Because they are fast, and your skeletal muscle responses are fast. Metabotropic receptors are slow, and your autonomic responses are generally slow. We good? 3 levels of control. No hierarchy. I'm not going to go over this. Know which parts comprise segmental, projection, and pre-command. Okay? know what they control, know what are the functions. For pre-command, I want to specifically highlight, do they have direct access to the muscles? They do not. They do not. Which level does have direct access to the muscles? Or levels? Projection and segmental. Right. Does that make sense? Is that clear? Can we move on? Difference between non-encapsulated and encapsulated, pretty obvious. 3 types of non-encapsulated free nerve endings, hair follicle receptors, and Merkel cells. For encapsulated, Meissner corpuscles, Pacinian corpuscles, bulbar corpuscles, and muscle, spindle, tendon organ, kinesthetic receptor in the joints. 6 types. Now, you won't have to list them all. So when you see the list, you have to understand which one is which. Am I clear? Know the types of sensations. Know if they are slow adapting or fast adapting. Okay? Whether they are tonic or phasic. Are we clear? Okay, generator potential and receptor potential. So generator potential, the receptor is what? Part of the cell. The generator potential the receptor potential, The receptor potential is the receptor and the neuron that transmits the sensation are different, right? The receptor cell releases neurotransmitter that initiates graded potential on the neuron downstream. Okay. Phasic, tonic, fast adapting, slow adapting. Which ones are more likely to be nociceptors? Tonic. Because you shouldn't adapt to the pain. Is that clear? Things like thermoreceptors, nociceptors, mechanoreceptors, proprioceptors, just know the terms. I won't tell you. So which one of those is proprioceptor, don't come to me and ask what is proprioceptor. You're supposed to know that. We clear? Circuit levels, ascending pathways. Perceptual level, somatosensory cortex. Okay, it's pretty much easy. What causes pain? I will start calling out names. Because I told someone what causes pain. Chemicals. Okay? Difference between myelinated fibers transmitting acute pain and non-myelinating transmitted dull pain. Opioids responsible for analgesia during the stress. Why visceral pain is perceived as the pain in certain body areas. Fibers from organs run through the same nerves as fibers from skin. Does that make sense? Good? Hyperalgesia, memorization of pain, pretty much. Phantom limb pain due to the overstimulation of spinal cord during the amputation. How do we get rid of it? Epidural anesthesia. And we've got this covered, I think, in the quiz that we just talked about. I already don't remember. Okay. Reflex arch, 5 components. Receptor, sensory neuron integration center, motor neuron effector. Know them like ABC. Seriously. Okay? Difference between monosynaptic, polysynaptic, somatic, and visceral arches. Okay? Does that make sense? know the differences. The difference in effectors, okay, and from the standpoint of number of motor neurons, in visceral you have 2 motor neurons, right? Preganglionic, postganglionic. In motor you have 1. Does that make sense? Okay. Muscle spindle versus tendon organ. Know the anatomy of muscle spindle, which means intrafusal fibers, annular spiral endings, flower spray endings, gamma efferent fibers, alpha efferent fibers. Which one innervates which muscle? Gamma innervate intrafusal, alpha innervate extrafusal. Sensation of stretch. Muscle is stretched, action potentials fire more frequently. What is the importance of alpha gamma coactivation? Okay, there's no alpha gamma co. If there would be no, okay, if there would be no alpha gamma coactivation, there would be no firing when the muscle is contracted. But there is, so even when the muscle, the extrafusal fibers contract, intrafusal contract. Does that make sense? No? That's your muscle spindle. If there is no alpha gamma coactivation, if extrafusal muscle contract, what happens to the length of the muscle? It shortens, right? So those intrafusal fibers will become like this. They'll just flop around. Okay? To avoid this, the whole, when muscle contract, intrafusal fibers contract as well, and also become shorter, that they still can feel the stretch of the muscle. Okay? Stretch reflex went so much over that. Understand, stretch of agonist muscle causes the contraction of agonist and relaxation of antagonist. Understand the flow of signal. Muscle spindle, afferent neuron, spinal cord, 2 efferent neurons. 1 neuron that stimulates contraction of the agonist muscle and another neuron that leads to the relaxation of the antagonist muscle. Know that it's reciprocal inhibition. Knee-jerk reflex, what muscle is stretched? Quads. Which muscle is inhibited? Hamstrings. That makes sense. What is the importance of stretch reflex? Clinical testing of integrity of the spinal cord, spinal nerves, adaptation, inhibition of stretch reflex, large amplitude of movements, oversensitivity of stretch reflex, perfect balance. Tendon reflex, kind of opposite. Stretched muscle is further relaxed, antagonist muscle is contracted. Okay? So that's going to be reciprocal activation. Flexor crossed extensor. Know pretty well the flow of signals, that you have sensory input on one side and you have motor output on both sides, right? On the ipsilateral side it will be this, on the contralateral side it will be this. Okay. 2 examples of this reflex, this and standing on something sharp. Okay, withdrawing your foot from something sharp. Plantar reflex should be this. If nerve is damaged, then it's going to be fanning out. Abdominal reflex, checking thoracic nerves. Umbilicus moves slightly towards the stroking blunt object. Okay. This is autonomic versus somatic. Cell bodies of autonomic are in ganglia. They are weakly myelinated or non-myelinated. Effectors, smooth cardiac muscles or glands, lent. There are 2 short preganglionic, long postganglionic, or vice versa, depending on the branch. Okay? Which neurotransmitters you can find in somatic nervous system? What does somatic nervous system control? Skeletal muscle. Which structure innervates skeletal muscle? Neuromuscular junction. Which neurotransmitter does it release? Only acetylcholine, period. You have to be able to make those connections. Okay? Autonomic, ACH, norepinephrine. Effects, different. Okay? Physiological functions, rest and digest versus mobilization. They both innervate same organs. Remember I told you to know organs that are controlled only by sympathetic system? Know them. I'll ask. I promise. This last one, it's a very fancy statement. When you exercise, your sympathetic system gets activated, period. Effects. You will get the question. If you would look at the quiz, which you have there, and I don't. I kind of have it in front of me. So, say, I tell you, what happens when your sympathetic system gets activated? Your pupils get, did I say sympathetic? Okay, your pupils get constricted. Your heart rate goes up. Your blood vessels get very much dilated. Your digestive organs get stimulated. Your digestion increases. You tell me, dude, it's whatever I said. Heart rate? You know, you pick one. That is right. So that's going to be the type of the question. So you have to look at the activity that I tell you and say, is that sympathetic stimulated activity or parasympathetic stimulated activity? Does it make sense? That's the example of the question. You will see them on the quiz. Got it? For parasympathetic, where do they start? Where do they synapse? Walls of organs so close to organs. Okay? Which ones are longer? We all talked about it. I will ask you which cranial nerves carry or not carry parasympathetic fibers. So you have to remember it's oculomotor, facial, glossopharyngeal, and vagus. Okay? I don't care about numbers. You may notice I don't ask much about ganglia. You have to know, though, what they innervate. So if I ask you, oculomotor nerve, parasympathetic fibers, what do they innervate? Don't try to convince me that it's muscles that move the eye. No. It's the sphincter pupillae, muscle that decreases the diameter of the pupil. Do I make sense? Same goes for glossopharyngeal. What are the effects? Parasympathetic fibers of facial nerve, do they control your facial expressions? Parasympathetic fibers in the facial nerve, do they control your facial expressions? Why they don't? No, yeah, exactly, because it's parasympathetic has nothing to do with skeletal muscles, right? It's autonomic. It doesn't have anything dealing with skeletal muscles. It would control glands, salivary glands, salivary glands, lacrimal glands, nasal glands, right? Vagus nerve should be or, just saw the typo. It's a problem. Or doesn't see the meaningless statements that I make sometimes. Look, if I ask you, which organs are most likely innervated by the parasympathetic fibers coming through the celiac ganglia? Don't convince me that they are eyes. Okay. It's going to be something in the upper abdomen. Celiac, right? So it's going to be either stomach or liver, pancreas, stuff like that. Does that make sense? I will make it very distinctive. Very clear. You think about this, like cranial nerves will be head except for vagus. Vagus, upper abdomen and thorax. Sacral nerves, lower abdomen, pelvis. Sympathetic system, all the same stuff. You have to know where they start. Bonnie? Kelsey? Questions? Okay. Same origin, thoracolumbar, cell bodies of preganglionic for sympathetic system. Sympathetic trunks, which one's longer, which one's shorter, kind of asks you all the same stuff on multiple occasions. Does that make sense? We have saying in Russian. Repetition is the mother of learning and the grandmother of stuttering. Where they can synapse. Remember we talked about different levels? They can synapse at the same level in the sympathetic trunk, on a different level on the sympathetic trunk, and in the peripheral ganglia. We good? In the collateral ganglia. Splanchnic nerves. Nerves that are formed by sympathetic and parasympathetic fibers. White and gray remicommunicants. White remicommunicants, preganglionic fibers enter sympathetic trunk through white remicommunicants. Postganglionic fibers leave sympathetic trunk through the gray remicommunicants. Why the white or gray? Because of myelination. Now, this gives you an idea of what I'm going to ask. Fibers that innervate dilator pupillae of the eye. Where would they originate? Most likely T1, T7, T12, or L2. T1. Does that make sense? You won't get a question T1, T2, T3, T4. I'm not going to do that. It's going to be very distinctive. Thorax, all the same. Abdomen. So it all goes the same. Effects of sympathetic activation. Okay. Organs that are stimulated. Physiological homeostatic importance. Be able to explain why it's so important to have like blood coagulation increased when we're fighting. Going back to it, comparison of sympathetic parasympathetic. Kind of helps you to build this little table. Autonomic reflexes, baroreceptor, emptying bladder and rectum. Just those simple things that we just talked about. Okay? Cholinergic versus adrenergic. Remember that little picture that we have recorded before? This one? Know it. Okay? Which, I will ask you, preganglionic fibers of sympathetic nervous system are short and cholinergic, long and adrenergic. Does that make sense? Tell me. Receptors for ACH. Know where muscarinic receptors are, where nicotinic receptors are. Adrenergic receptors. Where are they? What is the importance of knowing which types are there? Okay? Like, you have more beta-1 receptors on the heart, you can regulate the heart rate. You have more beta-2 receptors on the lungs, you can regulate dilation. Does that make sense? By binding different receptors. Effects from the nerves and adrenal medulla. Medullary effects are more systemic. Understand the effects of ACH and nicotinic and muscarinic receptor. They're stimulatory. Stimulation beta-1 stimulation of cardiac activity. Beta 2, dilation of bronchioles blood vessels. Beta 3, lipolysis. Alpha 1, constriction of dilation of pupils, constriction of visceral sphincters. Alpha 2, stimulation of coagulation, inhibition of pancreas. Now, mimetics and lytics. Know what parasympathomimetic or parasympatholytic means. Am I clear on that? That's going to be one of the hard questions. Okay, if you want to increase the activity of digestive system, what do you want to use? Probably parasympathomimetic. Does that make sense? I'm not going to ask you, is albuterol parasympathomimetic, parasympatholytic, sympathomimetic, or sympatholytic? I don't care. But if I tell you how to dilate bronchioles, okay, you have to think, what are you going to use? This is the list that you have to know on the effects. The differences that we discussed. Epinephrine is much cooler. It increases cardiac output. It doesn't dilate blood vessels that much, and it increases metabolism. Understand the tone. Sympathetic, parasympathetic, parasympathetic. Unique response is controlled by sympathetic system. Reproductive function as the synergistic response from sympathetic and parasympathetic. Differences: parasympathetic is local, short-lived. Sympathetic is systemic and long-lived. Hypothalamus, posterior, anterior. General function like medulla, a lot of visceral functions, pons, respiration, midbrain, upper structures like structures in the eyes, dilators, sphincters. Limbic system, physiological response to emotion. That's your answer. Okay? And just Raynaud's disease. When I say what is the mechanism, you can say overconstriction of the blood vessels in the peripheral limbs. That makes sense. Autonomic dysreflexia, just know, it's vasodilation above the spinal cord damage, vasoconstriction below. Any questions? Okay, I will see you on Thursday.